Imagine a bustling hospital reduced to silence, its corridors once filled with the voices of doctors, now echoing emptily. That's the haunting reality now facing northern Gaza as its vital Kamal Adwan hospital is tragically out of service. With the raid led by Israeli forces, the structure stands damaged, and its wards emptied, a devastating turn of events that leaves an alarming number of approximately 75,000 Palestinians vulnerable. These residents of northern Gaza, who relied heavily on this medical lifeline, now find themselves in an even more precarious position, a situation underscored by a recent United Nations report. The raid not only silenced the busy heart of medical care in the north, but also resulted in the dramatic arrest of the hospital's director, Dr. Hussam Abu Safiya. Accusations swirled around this unexpected development, branding Dr. Abu Safiya as a Hamas terrorist operative. This allegation has added a layer of tension and distrust to an already volatile scenario. The World Health Organization, WHO, and other entities have labeled the situation critical, describing the hospital as empty with its patients scattered. Those in desperate need of medical attention have faced harrowing transfers, some finding themselves at the Indonesian hospital. Yet, this relocation offers little solace as the WHO reveals, it too is out of function. With fewer options, many were taken to Al-Shifa Hospital in far-off Gaza City, stretching already limited resources further. Plans are underway, according to the UN, for WHO mission to the Indonesian hospital. It aims to facilitate the safe transport of these evacuated patients to southern Gaza, where care might hopefully be more stable. However, the journey promises to be fraught with uncertainty. Amidst this turmoil, Mohammed Salha, director at Al-Adha Hospital, sheds light on the dire state of medical services. He paints a grim picture when he says, "Kamal Adwan Hospital is totally out of service," pointing to his own facility as teetering on the brink, with scant supplies and a dire fuel situation, yet overwhelmed by the influx of patients. "Our one surgeon operates only under the most grave conditions," Salha laments. The North's healthcare infrastructure has crumbled, leaving a skeleton crew of professionals trying desperately to save what they can. Salha further questions the need for military approval, emphasizing how critical it is to allow the Red Cross access to shift patients who require specialized treatment. The United Nations Human Rights Office has stepped in, highlighting the severe degradation of Gaza's healthcare system. Their report is stark and frank, talking about the conflict since October 7, confessing to obliteration of medical services. The narrative of this deterioration invokes images of doctors and patients alike becoming unintended victims of war. Independent, credible, and transparent investigations are essential, insists the UN, urging all violations of international law to face accountability. As reports flood in of renewed Israeli military endeavors in the north, aiming to counteract Hamas activities, the situation grows tenser. The aftermath has transformed once thriving streets into fields of rubble, leaving supplies of food, water, and medicine significantly diminished. The Israeli Defense Forces, IDF, claim to have apprehended over 240 individuals classified as Hamas and Islamic Jihad terrorists in the hospital's vicinity. It marks the facility as a supposed terror stronghold, but does so without providing concrete evidence, a point that remains a sore spot for many. Dr. Abu Safiya's detention has resonance far beyond the confines of Gaza, igniting protests from Palestinians and drawing condemnation from international bodies and human rights organizations. Amnesty International offers a poignant depiction of Abu Safiya as the voice of Gaza's decimated health sector. They, alongside others, raise alarms over what they describe as Israel's attempts to silence healthcare workers through detention without due process. Amid shattered healthcare facilities and dwindling resources, aid efforts step in, albeit find themselves navigating a maze of obstructions. Since the initiation of the northern operations by Israel on October 6, aid reaching this enclave has been sparse. The UN's OCHA has logged thousands of truckloads entering Gaza, yet these are mere drops in a vast, arid desert of need. As December rolled in, Israeli authorities blocked almost all of the UN's humanitarian missions to the north, causing further entanglements in delivering aid, underscoring the challenge of meeting even the bare minimum requirements for Gaza's populace. Ocha paints a somber scene with Jonathan Whitall narrating a story of repeated denials faced by his team, unable to sate the desperate needs. Yet, the IDF insists that prior to last weekend's operations, patients were safely evacuated from the Kamal Adwan hospital, crediting themselves with supplying substantial amounts of fuel, food, and medical provisions. Even COGAT, the agency responsible for authorizing aid into Gaza, has been part of these efforts, albeit with a singular fuel truck aimed at refueling local bakeries. The dire humanitarian challenges in Gaza are profound. From scarce food to the gnashing claw of cold weather, the complications compound. Newborn reports are heart-wrenching, with health officials citing deaths to the freezing conditions. Tiny lives cut short by a climate of harshness both meteorological and political. Dr. Ghassan Abu Sita echoes this sense of impending doom, painting a bleak picture where death comes swiftly and brutally through hypothermia, malnutrition, or untreated injuries. His commentary in the digital space warns that these conditions will further erode the already fragile human condition in Gaza. As we pause on these unfolding events, it's clear this is far from the final word in an ongoing narrative of struggle and resilience. We'll continue following every development as the story evolves, shedding light on the challenges and hopes that color Gaza's horizon. Stay tuned as the world's gaze remains fixed on this unfolding drama.